Hello and welcome back to the Swine Disease Reporting System. This is report number 95. My name is Sajjan Kumar here at the SDR studio.
Hello, my name is Giovanni Treves. I'm from the SDRS team.
Hello, Daniel Linhares, also with the team.
Hello, Winler, also at the SDRS team.
And today we are pleased to welcome Dr. Kurt Kicker, the regional veterinarian at the Hanner Company. Dr. Kicker earned his DVM degree from the Iowa State University in 2013 and has been with the Hanner for 12 years, providing veterinary oversight and herd health strategies across large swine production systems in Oklahoma and beyond. He has actively contributed to national discussions on emerging swine diseases, including sharing his experiences during webinars hosted by the Swine Health Information Center and the American Association of Swine Veterinarians. And in today's episode, Dr. Kicker will share his experiences and insights on managing herd health strategies and challenges and advancing disease monitoring strategies. Welcome to the SDIS podcast, Dr. Kicker.
Yeah, thank you for the invitation. Look forward to our conversation.
I know we're going to have a very good conversation there, Dr. Kicker. And we have some updates of the SDRS, and today we're going to do a little bit different than just covering the month, but we're going to try to cover the year of 2025, since this is the first report of 2026 where we have information there. So can you bring us to update of what happened with different pathogens that started with PRRS during the year of 2025?
Yes, Doc. So for PRRS, in 2025, it hits the record levels in the winter market category. So nearly 45% of the positivity in the fall submission came back positivity, the highest since 2018. Speaking about the shifting in lineages, the older strains like lineage 1A and lineage 1H dropped off, while lineage 1C.5 became predominant. And within this lineage 1C.5, the variant 1C.5.32 made up more than half detections and spreading for the first time in the state of Kansas, Oklahoma, Pennsylvania, Ohio, and Texas.
Yeah, so lots of activity of PRRS that happened here, and was one we closed the year with one of the highest activity in finishing sites. How about enteric coronavirus, PED, Delta, and TG?
So for PED, we show a mixed picture in 2025. So cell farm hit historically low with over 7% positive in the winter and 4.5% in the fall. So it's the lowest since 2015. But in the winter market category, detections climbed to over 10% in the fall, the highest for that season since 2023. Overall, PD still stay within expected range. However, there were some spikes early in November that above expected range. The good news is that TGE remained absent with no positive since March 2021, despite extensive testing.
Well, at least some good news there on the Delta coronavirus with some activity of end of the year, of course. How about Mycoplasma pneumonia? I think it was an interesting year there.
So for Mycoplasma pneumonia showed a missed trend in 2025 as well. So cell farm detection stayed under 10% all year, but the winter market positivity climbed to nearly 30%. So it's the highest since 2019. And most of this was tied to intentional exposure protocols used to stabilize herds, while Iowa saw more cases of clinical cases from lung samples. At the same time, we've seen that the confirmed tissue diagnosis for Mycoplasma pneumonia from ISU in Ohio dropped to a record low of 221 cases.
Any updates for the sarcovirus, type 2 and type 3 and influenza?
So for PCV3, it remained the unique pattern, higher positivity in the cell farms than in the winter market category. So this trend has been held since 2018. For PCV2, the detections in the winter market sites dropped to just over 40%. So this is also the lowest since spring 2022. As for influenza A virus activity also historically low, with cell farms at 15% positivity and winter market at 35% positivity, both the lowest for the fall seasons since 2015.
And do you have any updates in terms of the confirmed tissue disease diagnosis?
So for diagnostic data from ISU and Ohio video, PRRS leading the way in 25 with more than 3,000 cases. Streptococcus suis follow with more than 1,500 cases and 1,500,000 cases, and influenza A virus at more than 800 cases. So together, these numbers underscore PRRS still continue as the dominance in the soil health, while other bacterial and viral pathogens remain the key contributor to the health challenges.
Well, that was quite a review, and when started talking about PRRS, finished talking about PRRS, right, in this retrospective, and that brings the first question here for Dr. Kicker, which is, well, we just heard that PRRS saw the highest positivity in winter market pig since 2018, with 1C specific 1C.5 specifically being the most predominant and it's spreading fast and wide. And so wanted to hear from you, Dr. Kicker, your experience with this with this particular virus, and how does the emergence of something as dominant as we're seeing right now with this specific variant changes your approach to or shapes your approach to herd health management.
Yeah, so I mean the newer strains or the most predominant new strains of PRRS have been increasingly harder to contain than previous years, and 2025 would be one of our hardest years, as well as very hard to treat. So we have a lot of unrewarding treatments that are occurring. So a lot of our focus within this past year has really been a lot of training of our caretakers, training of our employees on trying to identify, early indicators of disease. That may be, some respiratory disease, some coughing, some lethargy, but also, decreases in water and feed consumption. So a lot of this past year has been on the preventing the infection first, more so than the treatment, as far as changes of that. So, I mean, and then we would have, diagnostic sampling equipment on all of our employees, caretakers, and on our sites, so that we can kind of, once those early disease indicators are occurring, we can get samples submitted in a very timely fashion, so that we can try to, do more of our biocontainment strategies. So, first we have to know what do the pigs have? Is it something that we need to be concerned about, where we need to try to contain it? So, that's where we've done a lot of training with our caretakers, but also, submitting our much more, oral fluids and tissues from respiratory cases.
So combination of prevention, rapid detection, right, and then training people for biosecurity, biomanagement. And so, can you elaborate and expand a bit more on those practices around biosecurity and biocontainment, looking in that win-to-finish space?
Yeah, so I mean, Hanover in general has put a lot of effort into biosecurity culture within the last couple of years. So, that is where, we're starting up at the senior management level all the way down to the farm level. We're trying to make that culture be, a priority. So, we've kind of focused in on, the highest risk things and making sure we do those right every time, versus having, a whole bunch of little things that, sometimes are done right, sometimes are not. We're focusing in on the people and the people entry. And then we're focusing in on mortality removal, as well as transport. So those would be kind of the three big key items. And right now, for the people and the people entry, in our wean to finish system of over 315-ish sites or so in the Iowa Grow Finish region, we're about 80% of those sites are shower in and shower out for the people entry component. So that is a big shift that has occurred over the last couple of years. 100% of our nurseries would be shower in, shower out, and then working to get more of our wean to finish and finishing to try to get that to a higher level as well. And then, if we do have a disease, with the people component, if we do have a disease break, what we do is we try to segregate labor as best we can. So that's part of that early detection as well. So if we know the pigs have, one of these newer severe strains of PRRS, what we're doing is we're trying to segregate labor. And contain it to one person in, one person out, providing help if needed from external versus within that same group of people, so we're not spreading it around to other sites. And then, I said the mortality removal would be kind of the next biggest step for us, and that would be we have about 65% of our sites are on-site incineration, which would be, a little bit different than industry standard. And then, we have another 10% that are on-site compost. So we've got, roughly 75% of our grow finish system is on-site mortality disposal.
Mhm.
So then we only have about 25% of that where we have, a rendering service that is still coming to remove those mortalities for us. So, we're not immune to disease, but I think we've gotten away with a little bit more or done a little bit better on lateral disease transmission with not having an external rendering coming onto site as frequently as others would sometimes.
Yeah, no,
Uh,
thanks for sharing those.
Yep. And then one more thing there
Mhm.
as well, the last part of that would be transport. So we've done a lot of biosecurity improvements within our transport system. So we're about 2/3 conventional nursery. So all of those animals would be moving from the nursery to a finisher at some point within our grow finish region. And then about 1/3 of our system is wean to finish, and then we would double stock that. So we would have some movements as well. So all of our inner sanctum transport would
Mhm.
be washed, disinfected, and baked prior to showing up to that first site. And then and then those would move from the nursery to the finish or to the double stock to the finisher. And then if that finisher had a bad disease the previous turn, we actually would also not be doing any double rounds. So that would, we would be
Okay.
washing and baking every one. So as soon as that truck would touch that finisher that previously had a coronavirus or a bad PRRS the previous turn, it would have to go through a wash, disinfect, and bake before going back to our nursery or a wean to finish barn with young pigs at it. So we've done as much as we can to try to prevent the movement back into our young pig sites.
I see. Yeah. Thanks for sharing those practical solutions, right? Because and then you mentioned different pathogens, and that's what Win was reminding us here what happened in 2025, especially in that win to finish space. It's just a lot of lungs, a lot of pigs. So they're not only multiplying, they are amplifying the viruses and serving as a hotspot for uh, virus dissemination in the region that finds their way back to the sow farm. So all of those kind of holistic approaches that you're talking about helps to see everything as one whole herd, right? As opposed to isolated herds. So thanks for sharing that.
Yeah, and that brings me to wonder about one of the pathogens that you talked there was the enteric coronavirus there. And 2025 was marked by the discussion about, hey, can we start to move the needle in terms of elimination of some of those pathogens? And PD was one of those that the ASV discussed there. And with all of these biosecurity, biocontainment practices that you listed there, I was wondering if you could share some specific strategies that you see could be used and found effective to reduce the incidence of new outbreaks of PED and spread among sites there.
Yeah, so we use coronaviruses, PED specifically, as kind of an indicator of how well our biosecurity is working.
Hmm.
That's kind of a clear clinical picture on when we do get a coronavirus into, naive animals in a grow finish phase. It's usually, pretty quick. So what we've maintained a relatively low incidence in our sow farm regions. So most of our pigs, if not all of our pigs right now, are coming in negative for all coronaviruses. So once we do get one in our sow farm region, we work immediately to eradicate. We don't use any type of exposures or anything like that. All of our sow farms would be, negative for coronavirus. So the level of virus coming into our grow finish region, today is actually none right now. So we have done pretty good job on the sow farm level. But then as far as, we still have lateral disease pressure in high density areas. So, just right now, it's pit pumping season, nearing the end of that. So what we've done that I think has worked very well during that season is we designate 1 to 2 of our guys production guys to work with our owners of the facilities and work well in advance of when we think those pits are going to be needing to be pumped. And in our nurseries, in our wean to finish barns that have young pigs, we work to pump those pits out when the site is empty. So we're letting them know 2-3 months in advance, this is when your site will be empty. We would like you to pump it within this week if possible. And then we can go in and wash and disinfect before those new wean pigs arrive. So we were about 75% compliant with that this year, which was an improvement of last year was about 50%. So there is still some pits are getting full. Weather dictates a lot of that, but that has helped. But then, also, our nurseries and our wean to finish barns, we've implemented a testing all sites once those sites are full for coronaviruses. So all of our nurseries and wean to finish barns would fill over about a 1 to 2 week period. And then once those last pigs show up, we give it a day or two, and then we go in and we collect fecal samples to make sure that we don't mistake PED or Delta coronavirus for just post-weaning diarrhea. So we get a status of all of our wean pigs, and then any changes from that point on, we would retest. So at least we kind of have we didn't miss anything. And then now we can work to contain that if it is there. And it would be similar to our PRRS. Our caretakers and our employees would take those samples, submit those samples upon clinical disease, and then we would work to contain that. And then once we would have, our health pyramid apps on our phones, as well as door signs that signify, PD positive maintenance. Everyone would know that. We'd communicate that. And then once that site goes empty, we would do an extensive cleanup and eradicate as best we can all those sites as well.
Mm-hmm. Yeah, a lot of stuff from the environment there, right? Yeah, changing gears to influenza, right? Influenza, a virus. If we look at the testing, 2025 looked pretty flat compared to 2023 and 2024. So pretty much the same level of testing, at least visually here. But then positivity is down, right? In both sow farms and went to market pigs. And so wanted to pick your brain on influenza in general, right? Control, management, prevention, what have worked and what you have to share from your system and vet perspective on that.
Yeah, I mean, as far as influenza, preventions and treatments, we would not use any type of vaccination strategies on the growing pigs, but we would use quite a bit, varying degrees of influenza vaccination strategies on our sow farms. And then once we would, once we would kind of get an influenza positive in our grow finish pigs, we would be, for the first couple of days, we would be providing, anti-inflammatory and or supportive care through the water to kind of get those pigs feeling better that way. But then, some of those pigs may develop secondary bacterial pneumonia. And then, depending on the flow history or the tissue submitted, we would choose the appropriate antibiotic at that point. But, as far as the influenza, we would be detecting some as we're increasing respiratory submissions due to some of this PRRS that's moving around. So we've actually seen a little bit more influenza, and some of that is probably because in the past we would not have been testing for kind of those milder cases, but now with our increased strategy to determine PRRS sooner so we can contain it, we would test those for influenza as well.
So, Dr. Kicker, we have been talking about PRRS, influenza, and when you look for the most confirmed tissue disease diagnosis, there is Streptococcus suis on that group of the top 3 for the year of 2025, top 3 in terms of number of diagnosed there. Can you elaborate a little bit from the field perspective how you see these align what has been detected in the lab with what you have seen in the field there?
Yeah, I mean, most of our, tissue and or sample submissions would be for respiratory disease. And that would include, PRRS, influenza, like you stated, as being the number one viral causes of our submissions. Our most common bacterial isolate that would come back would be Streptococcus suis. But then our system would also see, high numbers of a Glassurella parasuis as long as a Mycoplasma hauerinus. But most of those bacterials that we would see would be secondary to a lateral PRRS or an influenza diagnosis. And those bacterials we typically don't see a problem with until we kind of get a viral instigator. But those bacterials that we would get, both the Streptococcus suis, the Mycoplasma hauerinus, and the Glassurella parasuis, we would have killed autogenous vaccines that we would be using, pre-feral in our sow herds to help control those.
And with that, wrap up today's episode. And thank you, Dr. Keeker, for joining us today. And from the SDRS, we wish you all a happy new year.
Thank you.
Thank you.
Awesome. Thank you. Happy New
Thank
Year.
you.
Happy New Year.
Thank you. See you on the next episode.